Hi, I'm Peter Gloviczki from Mayo Clinic, editor-in-chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. I am pleased to introduce the March issue of the JVS-VL and highlight 4 outstanding papers which are freely available for the next 2 months. The Editor's Choice article this month is on long-term outcomes following use of a composite wall stent Z-stent approach to iliofemoral venous stenting. It was written by Dr. Arjun Jayaraj and colleagues from Dr. Raju's group in Jackson, Mississippi. This is a retrospective study of prospectively collected data of 545 iliofemoral vein stenting in 535 patients using a composite stent configuration of a distal wall stent and a proximal Z-stent placed in patients with iliac vein obstruction. 5-year cumulative primary assisted, and secondary stent patencies were excellent, 70%, 99%, and 91% respectively. 30 lymph, 5.5% required contralateral stenting. There was only one instance, 0.2%, of a contralateral iliofemoral deep venous thrombosis. These data appear to be better, clearly, than results of using wall stent alone, as published previously by the same surgical group. The CME article for this issue is on the effect of concomitant deep venous reflux on truncal endovenous ablation outcomes in the Vascular Quality Initiative. This was written by Dr. Brown and colleagues from the University of Michigan in Ann Arbor. This VQI study included 4,881 patients with chronic venous disease who underwent saphenous vein ablation. 2,254, which is 46.2%, had combined deep and superficial venous reflux. Patients with concomitant reflux had a greater improvement in VCSS score after ablation than those with superficial reflux only. Patients with deep venous reflux, however, also had a higher rate of complications that included proximal thrombus extension, wound infection, pigmentation, and paresthesia. The next article reports 3 years follow-up results of the prospective European multi-center cohort study on cyanoacrylate embolization for treatment of refluxing great saphenous veins. This was authored by Dr. Thomas Probstl and colleagues. In this prospective international non-randomized study, 70 patients were treated with cyanoacrylate embolization of the great saphenous vein. 64 had 36-month follow-up at least, and 3-year saphenous vein occlusion rate was 88.5%. The venous clinical severity score, that was 4.3 before treatment, decreased to 0.9 at 3 years. The final article I would like to introduce to you today was written by Dr. Thomas O'Donnell and colleagues from Tufts University in Boston, Massachusetts, and the NICO Health Economics from St. Pete Beach, Florida. It is titled Correlation of Disease Comorbidity with Prescribed Treatment among Insured U.S. lymphedema patients. This study used data of the National Blue Health Intelligence Research Database and found that among close to 27,000 lymphedema patients, 1/3 were breast cancer patients, and up to 41% of these patients received conservative care that included manual lymphatic drainage, physical or occupational therapy and compression garments, and 24% of these patients received pneumatic compression. By contrast, venous ulcer patients with phlebital lymphedema were underrepresented in this conservative care group, 7.8%, but composed a disproportionately high share of the pneumatic compression group, 17.7%. So these data suggest that patients with phlebital lymphedema and venous ulcers are less likely to receive lymphedema-specific treatment than patients treated for breast cancer-related lymphedema. These were just 4 of the many excellent papers we published in the March issue of the JVS-VL. We hope you will enjoy reading all of them. Please read JVS journals in print, at our websites, on social media, and let us know if you have a comment or question. Thank you for watching, and see you next time for the highlights of the May issue of the JVS Venous and Lymphatic Disorders.